What is wrong with these ANC ministers? So the Minister of Health, Motsoaledi, the one who says cancel every single medical aid and come under his care, brushes off deaths of people who froze to death in a hospital and pretty much says, look on the bright side. In this video, I'm going to show you how patients froze to death in hospital because of dysfunctional management. Because the Health Ombud investigation found systemic failures, gross negligence, and widespread mismanagement that contributed directly to patients dying and getting harmed in a hospital. And there he is, smiling to receive the report from the Ombud. And the investigation revealed that the healthcare environment was plagued by everything caused by ANC corruption and wickedness. It had infrastructure collapse, prolonged power outages, leaking roofs, blocked sewage, the absence of emergency equipment. I can't. Let me let you hear it yourself.
Health Ombudsman Professor Taule Mokoena says investigations have revealed that some nurses were forced to work without electricity using torches on their mobile phones. Now, this is due to the electricity situation at the Kimberley Mental Health Hospital and the Robert Mangaliso Sobukwe Hospital in the Northern Cape. Mokoena has released the findings of an investigation into the treatment, complications and deaths of psychiatric patients at the hospitals. He added that the hospitals also have very poor infrastructure maintenance. Now, our reporter Calvin Dutla has more on this story.
We are at the Government Communications Information Systems here in Pretoria. That is where the Health Ombud's Professor Mokoena was releasing the findings on the complications and the treatments and the deaths of patients in the Northern Cape. But the Minister of Health, Dr. Aaron Motsoaledi, is here. He will be able to elaborate more on the reports. The findings are disturbing and encouraging.
Well, they are disturbing, but they make me very angry because some of the issues that happened should not have happened. Firstly, let's start with the fact that all these problems happened because of electrical cables were stolen and vandalized, and the destruction of a substation somewhere in Kimberley around those hospitals. But I'm saying that should not have led to any problem, because when load shedding started in Eskom, we said in the Department of Health, I was the minister then, my first term in health, we said with all the MECs in the whole country and dispatch a team of engineers from National to visit hospitals and check what generators they will need, whether they've got any, whether we need to increase them, how many we need to buy, what power can run such a hospital. We were doing so because Eskom had warned us then that if there's load shedding, they won't save hospitals. We tried to negotiate that, we failed. So we had to be on our own. We even asked that each hospital must choose a special person whose job is to check the generators, that they are working and doing their work, they are in good working order, they always have diesel and all that. So that it happened, it means that was ignored by the management. The second thing that disappointed me is that most of the investigations from Ombud found that it's management failures, not clinical care failure. That means doctors and nurses not doing the right thing. And I'm shocked to find that there are doctors here who need to be punished. Our doctors are trained in the same institutions around the whole country. And how come will doctors in that hospital fail even to do enough clinical protocols to treat pneumonia? It means there's something wrong with the total management, and we are going to look at that closely. And of course, I'm very disappointed about that. I never expected some of our doctors to behave in this manner. And I'm happy that the Ombud has even named them, the doctors who need to be taken up to account.
Minister, how many patients did you lose?
No, it's 2 patients who died.
And you can tell us now, let's talk about disciplinary issues now. I know you are not directly involved in disciplining officials, especially in public hospitals. There are those who are responsible for that. But have you gotten any report about accountability, disciplinary measures, suspension and all of that? Because we are talking about lives that were lost here. We can't just pretend as if nothing happened.
The report came out today, by the way. That they were witnessing that hospital, yes, we know, and we have sent people there. Some of the things have been corrected, but as to who must be taken to account and what must happen to that person has only been released today, so you don't expect us to have done that. When we sent the Ombud, and by the way, the Ombud was sent by myself, it's because something has already gone wrong. What the Ombud is going to investigate is what is that which went wrong and who and what must happen to that person. And that is what was released today. And you can see there are recommendations there. There are even people named. So the process of studying will whatever work will start immediately. But yes, you are right. I do not have any legal power to go and punish any hospital manager or provincial manager, etc. That power is in the provinces, but we'll make sure that we hold them to account to make sure that it happens.
Your message to the family of those family members who lost members?
Well, it's very painful always to lose a member, but I'm sure they must take heart of the fact that their beloved loved ones didn't die in vain. We've taken up the matter. There's going to be accountability. And of course, it brings cold comfort, but at least there's going to be accountability by the management, by doctors, and all the individuals who did not do their work.
Thank you very much, Minister.
Thank you.
Well, that was...
I can't even do this video. I was going to teach something here and try explain something. Okay, so here's my biblical reaction. May the pain of those families who've lost the two in that hospital, may the pain of those families descend upon every single ANC leader, starting from the top of the presidency to the NWC to the NEC. May the pain of those family members who lost people be transferred to every NEC member's family, every single NWC's family, and go down to every breakaway of the ANC. If you agree, press that. I've got nothing else to say. Let's make history together.